Good evening, everybody. We shall be starting the webinar in just 1 minute. Good evening, everybody. So we are going to start the webinar now. Good evening, everyone, and welcome to the Gyaan Vardhini session number 11. I'm Anand Nanavati from Clinsav team, and I thank each one of you to join us today as we embark on yet another enlightening journey of wisdom and knowledge enhancement. Before we begin, I would like to share a brief overview of the Clinsav app that we have developed over the last 5+ years. Clinsav means clinic savvy, and it is the only mobile-based clinic management app in India that allows you to manage your clinical practice in a full or 100% offline mode. It has a very simple design. Clinsav helps doctors easily manage patients, appointments, case papers, full prescriptions, bills, fees, issue of pre-filled letters, manage finances, and doing follow-ups with patients for any outstanding dues. Clinsav also sends automated appointments reminders 1 day in advance to your patients through SMS, and it also gives you the ability to simply swipe and send custom WhatsApp messages to your patients. So we'll start the webinar now. So we shall, our today's webinar topic is alopecia with a special reference to Indralupta case series. Our distinguished speaker for today is Dr. Shital Trivedi. Dr. Shital Trivedi is an MD Ayurveda having 10+ years of expertise in Dravguna Shastra or Ayurvedic pharmacology from Jamnagar, Gujarat Ayurveda University. Dr. Shital is a postgraduate diploma in yoga and naturopathy from Maharshi Patanjali Institute for Yoga, Naturopathy at Education and Research from Jamnagar, Gujarat Ayurveda University. Dr. Shital has worked as an associate professor of Dravyagun Department of Sain Ayurveda College, Matunga East, Mumbai. Dr. Shital is managing her Ayurvedic clinical practice for the past 10+ years at Arogyam Ayurveda Clinic in Matunga East, Mumbai. Apart from this, Dr. Shital has worked as a drug instructor at GMP certified Ayurveda pharmacy, Shaswat Ayurcare at Junagadh, and she has worked as an expert visiting doctor in Kerala Ayurvedic Hospital, Singapore. She has done clinical research on fungus infection with neoplasmodium instrument, has been a guest speaker at national international conference, and she is a specialist in hair, skin, obesity, thyroid, diabetes due to metabolic disorders. Dr. Shital, we are honored to have you with us today to conduct this webinar. Let us all welcome Dr. Shital Trivedi for today's session. Dear ma'am, you can start with your session now.
Thank you, Anandji. I am audible?
Yes, ma'am.
Thank you for giving this platform to interact with each other on the same platform. Thank you, Anandji, for that. Thank you all the team for giving me opportunity. Namaste, Gala sir, and all my colleagues and dear friends. I will share the PPT first. Happy Sharad Purnima to all of you. Hello. Can you see the PPT?
Yes, Dr. Shital.
So let's start. The first photograph, which I has put here in the first slide, is showing the two different aspects of alopecia. One is no, cicatricial alopecia, and another one is non-cicatricial. So this is mainly on the basis of the treatment. Like in scarring alopecia, the treatment is little difficult compared to the non-scarring alopecia. So today what we will see in today's discussion, this is a platform to discuss each other. This is not any teaching lecture. So here first we will see the Kesh as per the Ayurvedic point of view, and the Tridoshas, Tapta Dhatu, Mal, and etc. And Indralupta and Khalite, what is the difference between them? Apart from that, alopecia as per the conventional science, we will see a little difference in the different types of alopecia. And then compare and describe the different factors what we should analyze during our treatment part or the diagnosis way. Uh, 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 Besides on all this, we can see or we can tell the limitations and sometimes the prognosis also, or how duration of the treatment, how much we can tell the patient till how many times. So, and what is the difference mainly between alopecia areata and diffuse areata? So, alopecia. So here we will see the case discussion lastly. So what we should think for any of the hair disease. So here, when the patient will come in the clinic, first is to look the case definitely. So here, darshan, sparshan, and prashna. That is the base for the diagnosis as per the Ayurvedic point of view. Now we will merge the allopathic instrument or the other instrument which will be used in cosmetic or trichology. So that will help us to diagnose our way very efficiently. In the darshan, we can use trichoscope, microscope, or even we can use a simple photography of hair and scalp to compare before and after treatment. Plus another one is sparshan. By touching the scalp and hair, we can give the diagnosis properly. And the last one is prashna, that is history taking. Now, in history taking, we should consider some points like Prakriti of Kesha. Till today, we only see the Prakriti of Deha, Rogi, or Roga. But right now, if we are particularly see the hair patients, hair disorders, we should see the Prakriti of hair also, apart from the Prakriti of Deha and Rog. Then dosh vichar, dhatu vichar, mal vichar compared to the kesh and panchbhautik sangathan in the kesh, rog and rogi prakriti vichar, vyadhi vichar as per the allopathic and Ayurvedic both the points, treatment protocol and some hair care regimes and diets. Now if we will see the assessment criteria, so first is darshan. So always we can see the kesh patan or the patches in alopecia patients. So there is a number of patches the color, any discoloration or any type of fascicular formation lesions, anything we can see in the darshan pariksha. Then we can see the dandruff or the flex, either it is a powdery or flex. Then Keshabhumi, the scalp is also discolored. So we can see all the things like graying of hair and all in the darshan pariksha. In this version, we can see the dryness locally in the scalp or in the hair. So hair can be dry, frizzy. So after touching, we can see the difference. The most important thing in alopecia is scarring and non-scarring. In the scarring alopecia, because of the scar formation, the skin of scalp, or you can say the scalp, it is very, very smooth. And in non-scarring, you can see the little bit of dryness, or you can feel the hair follicles. You can feel the hair follicles. So that means now we can treat the patient easily. Then Prashna Pariksha, we can ask for the duration, then how many hair falls and itching or any type of burning or associated symptoms, and the long history taking forms from hair care products to the lifestyle, the daily regimes. So what we can see in scalp analysis, Here there are two methods, like one is a macroscopic study and another one is microscopic study. In the macroscopic study, we can use naked eye. We can use a naked eye to see all the details. Another one is we can use trichoscope, that is scalp analysis. And in the trichoscope, there is a first picture where we can see the details, little details about hair and scalp. And we can see the hair follicles, then some damage of the hair follicles, even exclamation hair, then tapered hair and all the things. Even when we see from the trichoscope, we can see the scalp is oily or dry. When we start this trichoscope, we can see the sweating also. So some patients get extra sweating because of some anxiety, some fear. So when we start using trichoscope, the sweat drops we can see in the trichoscope. We can see very clearly dandruff or flaky or the powdery scaling. Then the hair follicles we can see very clearly. It is oily or dry. Density of hair. Right now you can see in the PPT. Some hairs are dense, some hairs are very sparse. Then graying of hair. So in the D, ABCD, the first photo, in the D, you can see some of the white or the graying of hair, that is non-pigmented regrowing hair. So these all the things we can see with the help of trichoscope. And if we will go further, we can see in the microscope hair root, mainly hair root and hair shaft, the thickness of the hair medulla, this all things we can see in the microscope. Now, in the history taking form, some data or some points we should ask the patient, like the gender, age, that is the main, because as per the Ayurvedic point of view also, in the BAL, in the age, like childhood age, that is cough for predominant age, and we can see the patients of alopecia in kids also. So the treatment protocol will be different. In Pitach Vai, the protocol will be little different, and in after like 50 or 60, in Jaravasa, if the alopecia patient will come, the treatment will be more based on the Vata and Rasayan. So that is also the good factor to differential diagnosis. Another is area. Like from right now, I am seeing the patient from Mahul area where the pollution is much higher. So they have more fungal infection, skin disorders like eczema and all, and more about hair falls. Last month, we have done camps there, and more than 365 patients per day we have seen. 80% has hair fall, and 10% have alopecia in different types of alopecia. So the ratio is higher in that area compared to Dadar Matunga area. So that is also a main point uh, to see the patients. And apart from that, hard water is also a trigger factor. So now, in the history taking, the symptoms, the area and duration, that is the main important to see the differential diagnosis. Because when patient come with the hair fall, sometimes we can not diagnosis it is diffuse or it is patchy alopecia. So the area will suggest you or give you the more identification, duration, how many quantity of hair fall, in any dandruff or any itching or non-itching or scaly or powdery, wet or dry. Then split ends, dull hair, damaged hair, graying of hair, any baldness or the patch is gradual or it is sudden hair fall. So these all are the differential diagnosis point. Then the main point is any new hair growth is there or not. If new hair growth is not there, then we should directly consider it as a alopecia. Otherwise, sometimes in telogen effluism, there another sort of diseases where for the very short span, hair falls are there, but new hair growth is also there. That's why the treatment protocol will be little different. And we have to see any infection, any internal or external krumi like lice manifestation there or not. Then we have to ask for past illness, because in Ayurveda also we know that एक पहले जो रोग है ना उसमें से एक नया रोग जनरेट होता है. So any पुनरावर्तक ज्वर typhoid, malaria, dengue, after COVID, we have seen a lot of autoimmune disease patients right now. Mainly it is cough dominant. So we have to take past illness also, any family history, because one type is congenital alopecia. So we have to take family history also. Any medical history or current medications, sometimes they also trigger the disease. Now then after we have to take personal history, which we are taking in our day-to-day clinic in any of all of our patients. Udar parikshan, investigations, hair treatments and products, what we are using now, some food habits and timings, and hair care regimes. So after taking all this, now what we want to see in alopecia as per the Ayurvedic point of view. Now we all know that hair growth has cycles in three in numbers, like anagen phase, catagen phase, and telogen phase. And now there one a new phase. It is exogen phase. Recently, it is developed. The scientific terms of exogen phase is in between the catagen and telogen phase. The first one is anagen phase, that is growing phase, and in that phase, as per the Ayurvedic point of view, it is utpatti, or it is a cough dominant stage. Where in catagen phase, it is the hair follicles getting shrink, and in a resting phase before it is fall out. So that is a pitta stage or the sthiti, and the last one is laya. So in telogen phase, hair comes out. It is a shredding of hair, and the hair bulb become more and more clubbed. So it is a type of inactive, and it is a mainly falling stage. So patient comes in our clinic and they tell us about we have lot of hair falling is there. So sometimes what happens, it is a natural telogen phase, right? So it is not actually a disease phase, it is a telogen phase. So the telogen phase is from few weeks, like 3 to 4 weeks to 1.5 months also. In that duration, if we give medicines or not, they have to shred hair because it is a natural phase. So we have to see with the microscope, it is a telogen hair or not, then we can suggest them. Now in anagen phase, the timings are a lot more, like 5 to 7 years. Anagen phase is there. It means the growing hairs. It has all the hair characteristics like root, proper root, shaft, and tip. All the things with the proper hair follicles. It is Kafajka. The second one is catagen, what I said previously, that is starting of the clubbing. And the third one is typically shredding, that is Vat. Now, when we think about Kesh, always we think about Asthi because it is directly connected in classical textbook. But if we will merge all the classical reference, then from Rasa Dhatu to Shukra Dhatu, all the Dhatus are connected with a single hair string. So if you see the picture, am I audible, right?
Yes, Dr. Shil. Yes, Dr.
okay.
Sheetal.
Okay.
Ma'am, can you also switch on your video if that's possible?
Sorry, which one?
Your video.
Camera?
Yeah. Your camera, sorry.
Camera is switch off. Yeah, it is already switch off.
No, can you switch it on if that's not a problem?
Okay.
Yeah. Okay. Yeah. Thank you, ma'am.
So here, first Rasa Dhatu. So here I will give the first references, like Kesh is Asthimal. Another one is Sveda Vahanam Srotasam Medo Mulam Loma Kupascha. So here Lom means hair follicle. So it is related with Sveda Vaha Srotas also. The third one is Sved is again it is a Medman. So right now Kesh is also related with Med Dhatu. Twak is a Mansasya Upadhatu. So here we can see all the things in the Twak. So Kesh is related directly with the Twak. Kesh is also Majjasya Upadhatu as per the Sharangdar Samhita. So here if we see it is directly connected from Rasa to Shukra Dhatu. We will see again the connection in the further slides. Now Kesh with the three dosh, how to correlate a single strain with three dosh. So here the vat is a distal part of the hair. Here you can see the picture. There is a distal part that is directly we can connect with the vat dosha. Why? Because you can see the split ends, right? The split ends when we go with the reverse samprapti, always the patient has the vat predominant any of the disease, and that patient continues facing the split end problems and dryness and freeziness. So this all are related with vat. The middle portion, hair shaft, we can correlate with the pitta because the hair shaft has the main is the medulla and it represents the color of the hair. So that's why it is we can correlate with the pitta. And the root or the below the epidermis, that is the kapha. It is anchor. So it anchor the hair to the skin. So that's why we can connect with the kapha dosha. So all this is all related with this. If the patient has cough dominant disease or cough dominance in the kesh vikar, mainly we have to do the treatment from the root cause. If they have the distal end problem like split ends or something, so we can give the external treatment more than the internal treatment. So this is to give the proper treatment from internal to external or to external to internal. Now same we can see from the Stulmal Kesh with the Stulmal Kesh with the Sukshmamal. So here we will get all the references where we can see Kesh with the Dosh Dhatu and Mala. Now here we can see some of the Panchabhotik Sangathan or Panchabhotik relation. We cover some of the positive factors like if we will see Akash. So if the person is doing crash dieting or over exercise or recurrent fasting, their body produces more and more Akash Mahabhut. And so the Romakuk or the hair follicles or Svedvaha Srotas mainly affected with that. So when the person is coming that they have hair fall recurrent, then we can ask for the crash dieting, and some are taking obesity treatment. They have vice versa, they have hair fall issue. The same with second one is if the person is continuous open their air or they are directly connected with air directly no any example they are going by the train or they are going by the bike, so their hair is continuously open and windy, so that during traveling or if the person is using more blow dryer, then that vayu mahabhut is getting affected. And so we can see the such type of patient their hairs are more and more damaged, more dry, more freezy. The third one is Agni Mahabhut. If the person is using heat dryer or any straightening treatment or any coloring treatment, ironing, or using dye, or they are using more and more hot water for the head bath, so we can connect. This is increase in the Agni Mahabhut, and so the color of hair shaft will be changed, and you can see the graying of hair in such type of conditions. Now, if we will see Jal Mahabhut, so what the person who are using swimming or over showering daily or daily they are taking head bath or sometimes they are taking over and over water intake. So their Jal Mahabhut get hampered and so they have the reverse procedure in the sweat secretions or Rasrakta Samvahan. So their circulation will be hampered when now we are going for the Prithvi Mahabhut. So cosmetic products, dust, pollution all comes under Prithvi Mahabhut. And so who are using cosmetic or hair products more and more like gel or shampoo and all. So they are getting affected with the any subcutaneous fat or epidermal dermis issue or any scalp disorders mainly. So when the person is coming for any of the hair disease, we have to take the positive factors also, and according to that, we can give the opposite treatment. Same with the Kesh with the Sapta Dhatu relation. So now coming to the alopecia. So any kind of hair loss from scalp or from entire body or from any part of the body with or without any reason, which can be temporary or can be permanent, it all comes under alopecia. That is a common term. Now, alopecia has so many varieties. Mainly, we can see three main types in our day-to-day life. One is androgenic alopecia, second one is alopecia areata, third one is postpartum alopecia. Apart from that, we will see 1 or 2% of different type of alopecia. So now today we will talk on the alopecia areata mainly, because androgenic areata is alopecia is little bit yapia. You can say yapia. It is related with the hormones. That's why. So first is alopecia areata. It is autoimmune disorder as per the conventional science and sudden hair loss, especially in the scalp, face, beard, mustache, or any other part of the body. So it is divided in alopecia totalis, alopecia universalis, like that, the different type of alopecia as per the location. Now, the alopecia, for this, there are many factors are there. Psychological stress, social phobia, anxiety, this all are the trigger factors apart from the any physical entity. Now, here are some of the types. I will not go with them in detail, but you can see in day-to-day practice such kind of conditions: scarring and non-scarring, tinea capitis, congenital alopecia, androgenic alopecia, tractional alopecia, then chemotherapy-induced alopecia, telogen effluvium, and trichotillomania. So here, in all this, the picture of the hair loss can be nearly same, or sometimes we will get confused, like how can we differentiate this is fractional alopecia or this is alopecia areata. So we today we will go only one, but we can we can read different types and we can see the differential diagnosis. Now, mainly scalp analysis in alopecia, what we have to see the particular marks, like for the differential diagnosis. The first one is when you use trichoscope or dermascope, you can see yellow dots. So here in the first A, you can see the exclamation mark here in the yellow. So exclamation mark, we all know that is the upper side is little thicker, the lower end is thinner or the tapered. So here yellow dot denotes that. The another one is black dots. So in yellow dot, the infundibulum is this no, infundibulum is dilated and the sebum is there. That's why it is yellow spot. The black spot, it is broken hair. So it is denoted as a black dot. The third one is exclamation hair. You can see here in the exclamation hair in blue line. The fourth one is vellus hair. So vellus hair is very, very small hair. And the last one is non-pigmented regrowing hair. You can see in the red line and the red star. That is very, very small hair and whitish in color or graying of hair. So these five are the main differential diagnosis to diagnosis for the alopecia areata. Another one is in the androgenic alopecia, perifollicular white scales and brown dots can be seen. In fractional alopecia, honeycomb pattern and pinpoint white dots are there. Now, we will go with the classical reference. Indralupta is given in the Kshudra Rog as per the Social Sanhita, and it is called as Rakta Pradoshaj Vikar, wherein Ashtang Hridayam Sangra, it is in Kapalgat Rog or Shiro Rog. So Charak also said the same, it is comes under the Shiro Rog. So we have to combine different pathogenesis as per the classical text. So we will come to the Shiro Rog and Rakta Pradoshaj Vikar first and treatment accordingly. Again in Bangasen in Yoga Ratnakar, it is given in the Shudra Rog. In the Charak Sanhita, in the Viman San, Acharya said that overuse of salt and alkali means lavan and क्षार का अतियोग करने से भी खालित्य होता है, and खालित्य and इंद्रलोक generally they are same in all the Sanhitas apart from the Ashtang Hriday and Sangra. So another one is Charak also use or given this disease in the Udhu Jatragat Rog and Dushta Pratishay Janya Vyadhi as a Upadrav Swarup. So we have to take history of the Pratishay or the recurrent rhinitis of the patient if the patient was suffering or suffering continuously, then we have to first treat the pratishay and then alopecia. Bhav Prakash also classified alopecia in a different way. We will go with the social Sanhita because it should give the proper pathogenesis for the disease. Indralupta is given in the Kshudra Rog, and Khalitya it is a synonym of Indralupta. So the treatment will be same, either Khalitya or Indralupta. The treatment will be same as per the social Sanhita. Mainly it is given into Rakta Pradusha Vyadhi. So what Acharya told is Pitta along with Vat by involving the root of the hair. It means hair follicles, causes fall of hair and thereafter Sleshma along with Shonit. It means cough and Rakta obstruct the channel of Romko, means hair follicles leading to the stoppage of the regeneration of the hair. It is called Indralupta. Means first Vat and Pitta वो इकट्ठा होते हैं, वो हेयर फॉलिकल्स को निकालते हैं, सो श्रेडिंग करते हैं एंड देन आफ्टर वो जो श्रेड हुआ है हेयर उसको श्लेष्मा एंड रक्त दोनों मिलके ब्लॉक करते हैं, सो न्यू हेयर ग्रोथ इसके लिए नहीं होगा. दैट इज कॉल्ड इंद्रलुप्त. एज फॉर द कार्तिक commentator of Madhav Nidan, Indralupta, he gave the locations and the name accordingly, like Indralupta in beard and mustache, Khalitya in on head, mainly scalp, and Ruhiya all over the body. Acharya Charak has mentioned that page by involving Vatadi dosh reaches to the scalp and it result in the Indralupta. उसमें दूसरा कुछ भी इसमें details नहीं है. Vasav Rajya and Sushrut mainly given Indralupta treatment as a Rome Bhujisho. It means creamy treatment. So here this point is also valuable in today's practical era. So we have to do creamy treatment first. In Astang Sangra, given the types of Khalitya, that is Vataj, Pitaj, Kapaj and Sannipataj. Now we will go with the Samprati, Ushna and Tikshna of Pitta. Plus, this is first Samprapti is with the Charak Sanhita. देह उष्मा burns the केश भूमि, मीन्स केश भूमि जो स्काल्प है उसको बर्न होता है एंड दैट्स व्हाई वात और पित्त के कारण रूट्स निकल जाते हैं, राइट. एंड देन उसको कवर करेगा स्निग्ध एंड पिच्छल ऑफ कफ विथ रक्त which dried up the pores and scalp and obstruct the new hair growth coming out. So this is means pathogenesis for the alopecia or the Indralupta. Now, as Indralupta is not separately given any causative factors or any uparos, so here it is comes under Shirorog. So Nidan can be considered as the Shirorog Nidan. So here so many Nidans which patient is doing in the day-to-day life. Now, since my clinical practice is 10 plus year, it is not more. But what I have seen is in the last week is 627 number of patients for typical alopecia. And all these cases, I have seen the 4 main pathogenesis in adult and kids. The first one is arm nirmiti. So any of the pradoshaj vyadhi comes under arm nirmiti. So here aharaj, viharaj and manasvav, which leads to alopecia, and ignorance of pratisha or the treatment. So recurrent treatment, recurrent pratisha or recurrent rhinitis, patient is ignored or patient is taking allopathy continuously, which leads or which giving the negative feedback to the body and it converted into the alopecia or Indralupta. So here first is Amanirmitij or Pradoshaj Vyadhi. In Charak Samhita also, Acharya discussed about Ati Lavan Kshar or Ati Kshar or Ati Lavan Sevan plus Virudahar also is a trigger factor for Khalitya. In Majjava Sroto Dushki Hetu, Virudahar Sevan is also given. So here Majjakshay is also there or Majja Pradoshaj Vikar is also there. In Asti Pradoshaj Vikar, Khalitya is given. So here, in so many references, we can see the Khalitya or Indralupta. The another pathogenesis in adult is Kshayaj. So there are 2 Kshayaj pathogenesis given in the textbook. That is Asti Dhatu Kshay directly. That is the word is Kesh Sadan. The another one is Swed Shaya. Here the word is given Romachuti. So Kesh is a different, Rom is different. Okay? So previously we told that obesity treatment means weight loss, any therapy, over exercise or starvation or chemotherapy leads to Shayajanya uh, alopecia. The third one is in the kids, mainly it is Krumijanya. In the classical textbook also, Raktaj Krumi, Acharya has given many types, among them Keshat and Lomat or Roma Vidwans. That is also a type where the typically Kesh and Lom is vitiated with the creamy. The fourth one is Dushi Vish or Krutrim Vish. We have discussed this with Shrikant sir, and we come to the conclusion about Dushi Vish or Krutrim Vish because we are using more about cosmetic or hair products right now nowadays. So many hair accessories we are using. Apart from that, hard water or pesticides and metals in the water also the trigger factor for this. So there are mainly four sampratis. Now, we will go with the Chikitsa Sutra. This is as per the Sanhita. Practically, this is little bit than the practical things. So here, Vaman Virechan Nasya Shirobhyam, Shodhan, then as per the Indralupta and Palita Acharya Vagpat has given, then Prachan Karma Pralep. This all are given. Now, in our patient, how to start with or how to see the difference, like we should do Shodhan or we should do Saman or we should do Prachan. So, this is Sushru Sanhita, Chikitsa Sutra. Snehan Svedan, Rakta Mokshan, Lep, Sirobhyam, Prachanna, Rasayan. And lastly is Krimi's Chikitsa is there. So, as per the pathogenesis which I have seen, I have made my protocol. That is a coming from the classical textbook and the practical things. So, if the Soto Janya or the any Pradoshaj Vikara are there, we can start with the Dipan Pachan, Langan. In the Langan, Charit Sanhita has given 10 types. So, Vaman, Virechan, Nasya, Basti, all comes under the Langan. So, basically, it is a Shodhan Kriya. Sorry. Now, external, we can do any Tikshna lip or using any Tikshna oil for the scraping purpose or to remove the scrotums. We can do Lekhan, Prachana, Kuttan. And after that, once the armor can be removed, we can use Ropan and Keshvardhan, Kesha and Rasayan Chikitsa. Lastly, same with the Kshayjanya Samprapti, we should start with the Ripan Pachan first. भले वो क्षय हो, but still it is Ripan Pachan ऐसा देना चाहिए जो ब्रूहण भी करे. Example Shatavi we can give. If the patient is in Niram condition, then only we can use Bruhan Chikitsa. Otherwise, start with the Ripan Pachan first. If the patient is in Niram condition, we can use Bruhan. Internally, even Bruhan Nasir, Tiktakshir Basti or Yapan Basti, and lastly, Kesha and Rasandra. The third one is Krumi Janya Samprapti, where we can start with the Ajina treatment or directly Krumigna treatment. We can use Shodhan Nasir and later on we can use Bruhan. But for first of all, our main aim will be the Krumi Nirharan anyhow. Later Rakta Prasadan, Kesha and Rasayan. The same with Vishajanya Chikitsa, that is a Vishhar Chikitsa, starting with the Shodhan, then Vishhar, and then lastly Suvarnakalpa or any Rasayan. Now the practical approach for the external treatment. The first one is Snehan Svedan locally. Another one is Nasya. So we all have visited or learned so many things from Dalasar. And the first protocol is Shodhan, either with GS or with Pradhaman. So the first aim is if the patient is mainly arm or Samta or any type of Sotorok condition, we should use Shodhan Nasya, then Shaman and then Bruha. So here same thing will be applied. As this is a Shirogat rog, Nasya will be the one of the best treatment to regrowth new hair. The another one is Derma roller, that is Kuttan Kriya. Then apart from that, micro needling also will be very good options in female mainly. Derma roller is little difficult in female hair, but microneedling is better than female hair because the hair length is very long. Derma roller, it is little difficult because of the length, and it is a roller. So the hair gets stuck in the roller. So microneedling or derma pen will be the better. The main is leech therapy. If it is Rakta Pradosha, typically, like we can see the discoloration or any other Kushtha Vyadhi along with the alopecia, we should use leech therapy or Siraved. It is given in the Sanhita also. Siraved you can use. The Apart from that, I am using Prachan externally by Chabedi Rasa Sanjeevanivati, or you can use anything like Gunjabi Lep or Jaipal, anything we can use. I have made Jaipal oil and Gunja oil. So Gunja oil is there in the market. Jaipal oil is not in the market. It is not available. So one can make Jaipal oil because Jaipal is very, very thick. So if it is very irritant, so it is irritant 2 times more than the gunja. So if we want to create some irritation in um, the greasy area, so we can use Jaipal, but it comes with the pustular formation sometimes. So to avoid this, mainly in the Mumbai city where the cosmetic, the external appearance is more important. So I am using Jaipal oil, and last 5 years I am using that. There is not a single issue with the Jaipal oil, and it works very good. So you can use any of your patients, uh, any hair growth serum if you are okay with, or if you have knowledge. I am not using hair growth serum more. Body is producing growth factors in plasma. So we can use with the Dermarol and Micropen, Dermapen, the hair growth serum you can use. Then a hair grow lake. So uh, previously Hastidan Masi is given in the textbook. Right now we cannot procure that. So what we can do is any khur masi. Khur means nails of or khar of the any of the animals or nails you can use. Another one is Mesha Shrunga Bhasma is readily available. So you can use it also. Or you can use Kesh Masi. So I have made that masi from the cache. So it is also giving a good result. Nasya, as I told you, and we all know because of Kala sir, we are using in day-to-day practice in each and every patient. And mainly, Acharya Vagbhat also have mentioned that some Shaman Nasya is useful in Kesh rope. So it is one of the best choice. Now, I try to uh, relate each and every dhatu with case and treatment protocols, how I am using it. So, one is Santarpanat, so many diseases in the Santarpanat Vyadi, and another one is Aptarpanat Vyadi. So, here there is some protocols when we can use drugs or the how we can select the drugs in Santarpanat and Aptarpanat. There are some examples. I will not go with that in detail. Then Rakta Dhatu, Mouse and Meda Dhatu, Asti Dhatu. Mainly Asti, we have to do Shaman Chikisa. There is no Shodhan in Asti Dhatu. So there is Panchatikta Gurugul or Asti Pachak or Guruchi Musta drugs are there, which gives Asti Pachak initially in Santarpanat Vyadhi related with Asti Dhatu. In Aptarpanat, we can directly give Shir Basti or any of the Abhadi or Lakshadi Google or Vasant Kalpa. So Asti and Majar combined, it is directly, so the treatment will be the same. Mostly it is the same. Shukra Dhatu is little different. So if it is endogenic alopecia, we can use this protocol also in Santarpanot and Aptarpanot condition. Now we will go with the cases directly. So this is the first case. Everyone can see this. Hello, I'm audible.
Yes, Dr.
Right?
Shital.
Yes, it's visible.
Yes, it's visible, Dr. Shital.
Yeah. So there is a first visit, the below picture. After leach, upper side is after leach. Picture is there. Right side after 3.5 months. The little that is non-pigment and NPRH hairs are coming. So it is white in color. So always in alopecia, the first hair which will comes out, it is white hair. So initially patient asked us that why the white hairs are coming. So treatment is not good or something is there. We should use dye. But after the shading of that hair, the another hair after 6 months, it will be black one. So there is no not to worry for that. The first one is this is the 3.5 months later, the result. And after 6 months, patient gets all the hairs completely in that page. So here we will go with the details. The 35-year-old male IT engineer, the main complaint is solitary patches. So here, first difference is there is only one patch. Otherwise, it is a persistent patchy alopecia is also there. So one patch, after some time, another, then third, then fourth patches can be come. So this is only solitary patch in left temporal area. Only 1 month was there. So patient came directly because he took already some previous treatment in the clinic. So he knew about the hair disease and we are treating that. There is no itching, no burning in the patch, and sensations are there. Hair falls since 4 to 5 years after COVID. Hair falls was there so much. So it is more than 20 hairs per day, and the new hair growth are also there. So that is not to worry, but the main is the single patch would come. The past history is the patient is cough dominant prakriti, on and off allergic rhinitis, cold and cough. It is more than 10 to 20 times in a year. After treatment in the clinic previously, the patient's this allergic rhinitis went away, but still seasonal cold and cough was there. The dandruff is mostly powdery on and off, and vitiligo at the age of 7 years. So we can see all the diseases are mainly cough dominant. And again, when he came to clinic, I told for the thyroid investigation, and it came 6.9. And it is the proactive hypothyroidism. So this all picture shows us about the cough dominant conditions. Now, when we see in the scalp analysis, first I touch the scalp. It is very greasy in that is bald area. It is non-scarring. So alopecia areata is known for the non-scarring pattern. Hair density was good. Black dot was seen in the peripheral area and yellow dot in the central area. Small pustular eruptions are there in some areas, and patient has acne issue also. Hair length is medium, dandruff is moderate all over scalp, and it is coming on and off. It is there. Dandruff is there all over the season, all over the year. Patient is continuous sitting under the AC. So AC is also one of the factors for powdery scaling. Now the thinning is there in the surrounding area, not all the scalp. So that is also we have to consider. Now what we can do in the clinic is hair floating test. It is easily we can do. So should I go with the details of hair floating test, or everyone knows this?
Ma'am, I would suggest you can go ahead with the details.
Okay.
Yeah.
So in Ayurveda, we know that is Sam and Niram, and we know the Puris Nimanjan thing is there. So how we can see Sam and Niram condition in Puris, same way here in the hair also. Hello.
Yes, Dr. Shital, we can hear you now. Yeah.
I am continuously hearing my voice again and again.
Yeah, the echo is gone now. Yes.
Okay.
Yes, Dr. Shital.
So same thing here, low porosity, medium porosity, and high porosity. There is a hair floating test in the conventional science. The same thing we can see in Sam and Niram condition. Now in this patient, you can see the hair, right? So it is floating. it means it is low porosity. Once the hair is porous, the moisture or water they retain more. In the low porosity, they don't retain more water and moisture. So this is, we can call it as Nira. So hair is Nira. Now hair pull test and tuck test. That is also another test. We can do it at the clinic. So the pulling test, doctor has to take 50 to 60 hair tufts, and together from the fingers we can pull it. And if the 10 percentage to more, if the hair comes in our hand, it means it is a positive test, right? It is uh, intelligent phase. In the tuck test, it is we have to see for the elasticity. So with the two fingers, we have to take the 50 to 20 hairs or the bunch of hairs, and we have to tug it. So if if the hair is in telogen phase or it is very brittle, it comes out like so many hairs will be broken. So it is mainly it is differential diagnosis for another disease, hair issues with the alopecia. In the alopecia patients, the surrounding hairs, the tech is always positive because the surrounding hairs are very thin and it is very brittle. And gradually that is in the round and round, that is in oval shape, the patches become more and more wider. So the hair in the periphery are more and more brittle. So this is a positive test in all the cases. Now in this case, the prakriti of the person is kapha dominant. The second one is vata anubandh. Mal, it is also mean important thing that on and off he had faced hard stool with strain, and it takes long time, like 30, well, 50 to 20 minutes sometimes, and patient used to take mobile in the toilet. So maybe it is also one of the trigger factor. It is in the Udavat also, and it comes under Ajina also. So patient has very Kshuddha Mandya. Typically, he has very low appetite, but the patient stout, he is stout in all over structure wise, and he is going to the gym, but still the hunger is not good. Jaran Sakti and Abhyavaran Sakti both are not good. Apart from that, Mutra is okay, Kshuddha is Mandya, Swed is also Kshaya. So only during the gym he is getting little sweating. Otherwise, he is not getting sweat. So Jiva, at the intestinal area, it is Samta or Uflep was there. Udar is Kathinya because he is a gym going person. So we have to see, as Gala sir told, the side of the rectus abdominis we have to see. So that also it is Kathinya. Then SLR, it is 60 angle. So there is stiffness in the pelvic area also. The treatment part I will tell later. There is a common protocol for all. So we will do it later. The another case, there is a girl. That is the first visit. First photo is first visit. Then 1.5 months later. Then 3.5 months later, there are a little hairs coming out, and 7 months that was a full of hair. So that is covered properly. Right side two photos are from the occipital area. So she has more than 7 to 8 patches in the scalp, and some are diffuse, some are typically oval and round shape. Here in the pictures, in the right side lower picture, you can see the small vellus hair, black and white both. So that is when the patient is in recovery phase or in after 3 or 4 months, this comes first. This type of hairs are coming. So otherwise, you can see all the hairs are black. Only that patchy hairs are little white. So she is 22-year girl, a student, and starting with 1 or 2 pages, and it goes to 7 to 8 pages. So after 6 months, I think 5 to 6 months, she came to clinic and she tried all the trichologists, 2 to 3 trichologists, and one Ayurvedic clinic also. and the patches are going up, and means patches are increasing in numbers, and it wider and wider. So and itching is there in this patient, no burning in the patch. Hair falls since 3 to 4 years, means before coming to the clinic, it is there since 3 to 4 years, and it is more than 30 hairs. I told each and every patient to take picture of the hairs daily when they comb or when they do shampoo. Collect the hair and give me for a 1 day data. So it will be easy for us to see the difference between how we after medications, how the hair falls are decreasing. So then their powdery dandruff are there on and off. Pindicodeston is there as a complaint. On and off, Udar Shul, Angamard, ISS, Vaskastata, Bhram. These all symptoms were there. The patient's past history is recurrent fever, and she is taking allopathy medicines for fever. Then, in the 6 years span, she faced malaria, dengue, and typhoid. So, all the related with jwar, and mainly it affects on the yakrut. So, we have to think about Rakta Pradosha Vyadhi. In the scalp analysis, I have seen the greasy scalp, non-scarring pattern, sparse hair length is good, dandruff was there, very mild, but it is there all over scalp. Thinning and dryness of hair are there, and it is very frizzy from the distal ends. And hair floating case is high porosity, it is sinking in the water, and so it is mainly Samta is there. Then full taste is more than 15 hairs came out, and tuck taste it is very brittle. So once you tuck the hair, literally it breaks down. So in so many fragments. So the severity was there. Prakriti was Vat and Pitta dominant, Mala once or twice, and sometimes hard initially and then soft, sticky, foul smell and farty. Mutra is little yellowish, Ati Swed Pravruti. Arthav history is okay, but sometimes she was facing menorrhagia, but it was not regular. Regular cycle is normal. Shudha Mandya, she used to take so many junk food from outside, so she was not taking cooked home food. Mainly, she is taking sandwich, vada pav, kurkure, bread, butter, everything, and any sweet like cake or pastry, something. She is going in the college, so she was taking all this stuff. Jiva was spotted centrally, and on and off stomatitis history were there. Udar shul around the umbilicus was there, and Kathini. SLR was 80 angle. Face is little pale and less expressive when she first came in the clinic. Later, after 3 or 4 months later, she was more and more expressive after getting results, because maybe she was in very tense. When I started the trichoscope, when I see the scalp from the trichoscope, uh, very fast the drops of sweat was coming, so fast, like 10 to 15 drops coming like continuously. And I have to start AC for her, because otherwise I'm switching off everything like fan and AC to see the proper difference in the trichoscope. Otherwise sometimes we can miss something because of coming hairy here and there. So she is in very much in anxiety and fear about the external appearance. Now this is the third case. The first visit, the patient, this is a centrally diffuse alopecia, and another patches are also there in the scalp. In the second month, I want to tell everyone that when the patients are coming first in the first visit, they have profuse hair fall, right? And more than 50 to 60 to 100 hairs are shading every day. But when we started treatment, till 1 month even, we cannot stop that hair falls in every patient. Even this patient shed more and more hairs in 1 month rather than the previous stage. So she literally scared about my hairs was falling more and more. But it is because the hair roots were very big. And so initially, when we start any treatment, the older or the weaker roots first came out. So the issue can be raised initially, but later it will be beneficial because the new hair root will be more and more stronger. So second month, you can see more sparse hair than the first month. Then after 4.5 or 4 to 5 months later, the hairs now started to cover the scalp because the length is also good and the scalp is also not visible much than the previous one. After 7 months, right now she is also there in the clinic coming for the Rasayan Chikitsa. All hair comes very easily after 7 months, and from all 3 or 4 patches it is there. So that is 24-year-old girl. She is doing job. The visible hair that patient complains this. After that, I ask another question. So this is patient's complaint that visible hair loss are seen in since 2 years, patches since 4 months, and discoloration in the scalp. It is typically brown, black, and bluish discoloration together on the scalp. So first, if we see on only scalp, it is like literally it is like any type of skin disease rather than the alopecia. So the discoloration was very much. Then dry and damaged hair, severe dandruff. Even right now also she is sometimes facing dandruff issue. Then nauseatic feeling, heaviness after meal, every meal, belching, then body ache, could show, vertigo, and sometimes blackout. And the past history was jaundice 2 years back. After jaundice, she has facing sudden hair loss, and the scalp analysis. There is first is greasy scalp, and then non-scarring pattern. Density was medium. Black dots and exclamation hair is seen in this patient particularly. Hair length is okay. It is not much good, but it was okay. Dandruff all over scalp. Thinning of hair all over scalp was there. And right now you can see the difference in the photo, the thinning of hair. So right now the hair become more thicker than the previous one. Floating test is low porosity, it is Mira. Pull test is more and more hairs are coming out, and tug test it is also brittle hairs. The Prakriti is with dominant Vata Anubandh. The Mala, they have urgency in stool. So she used to go with 2 to 3 times. Right now, after treatment, it is once in a day. Sometimes, if she took outside food in the party or some occasions, then 2 times. Otherwise, right now, only once in a day. When patient came in the clinic, she was facing hard stool. So initially I have to give Pitta Anuloman. Later I work on the urgency. The history of fissure plus bleeding was there. Mutra was Sadaha Pitta and Ati Sweet Pravruti with foul smelling. So she is typically Pitta dominant Prakruti. Shuddha Mande was there because of she is also taking outside food more and more, and she cannot digest it properly. So it mainly it comes under Vataj Gahani. Jiva was Shweta, Pandu was white coating with blackish dots, and Udar is Yakrut Pradeshi Kathini. So, in all these, all three cases, I am using the protocols like in the first visit. Generally, in this type of condition, we have to remove any of the Srotorol. So, first protocol is Shrotoshodha, any form of like external, internal, any. So we can think Ajina, Grahni, Udavat or Krumi, right? In each and every patient, we can see the difference, associate symptoms apart from the alopecia. So we have to consider alopecia first, but we have to see the main srotas, like the main system. इन उसमें क्या इश्यू है पहले वो देखना है, पैरेलली हमें एलोपेशिया को कंसिडर करना है. So Deepan Pachan, if the urgency is there, as per the Gala sir told us, teach us very well that if urgency is there, Grahi Chikitsa, if urgency is not there, then we can give Pitta Anuloman in this condition. Then external Prachan, Krumi Har, anything you can use. You can use Sanjivani, Icha Vedi, Jaipal or Gunja even. Langan for 3 days or Lagu Ahar. Shodhan Nasya initially and then Jaloka. So I'm using Jaloka, and after 1 week or second week, if I feel the patient is little Niram or the Samta is little less, then I am using Jaloka. The next 2 months, like this is first month protocol, next 2 months, if I am feeling that first month what I have to see in patients the difference, and if patient is doing properly, then second month I start with the Pachan or Shaman. Some patients have issues, Roto-Rod issues are much more, or Kled or Pradoshit Vikar are much more. So we have to extend the medicines for long time. If the patient in Miram condition or Samta is little less, we can start with the Ras Rakta Pacha, Grahani or Udavat Chikitsa parallelly. In female, mainly I have seen in both the female, they are more about Pandu. So any medications which will be support the Pandu, we can start with that also. And Shaman Nasya, because we have showed beat the Shodhan. So if the, as per Kalasar told us, if GS is 2 drops, now we can consider that the Shroto road in the local area is gone. So we can start with the Shaman Nasya. And I'm using in the second or third month Dharma roller or Dharma pen. Then this is 2 to 3 months, it takes time, and after that 4 to 7 months in between, if the patient is typically Niram, and now we can start with the Rasayan Chikitsa. So Rakta Prasadak, any drugs, Kesha drugs, Rasayan, Suvan Kalpa, Chavanprash. And in the Nasya, now start with the Bruhan Nasya or any Kesha Nasya like Yashti Amalki Nasya, Panchendri Vardhan also you can use, even Bhungraj Nasya. And if the all the hairs are coming in a proper way, so we can the frequency of derma roller or derma pen we can do in every 15 days or 1 month. So it's depend upon patient to patient. But after that, the result will be little faster than the conventional treatment. So this is the general treatment protocol. In these three patients, each and every patient has a different medications and different timings for this protocol. So there are some medications which can be used or you can select as per your clinical practice. That is Anuloman, that Erenrus, Haritaki, Turkrut, Brusht, Manibhadra, Aragvat Panchak, Avipatika, simple can be used, or Trifla with the different Anupan you can use. In the Ruksh Virechan, we can use Bruhat Manjisthadi or Patol Muladi Yog. We should consider um, alopecia because it is attached with the scalp. It means attached with the skin. So we have to see any kushta vikar is there or not. Sometimes two diseases together merge, and we have to treat kushta also and alopecia also. So here we can use Kushtagna Mahakashai because Kushtagna Mahakashai is mainly works on the kapha dosh, and here the main issue is kapha predominant dosha. So Kushtagna Mahakashai, Khadir or any combination from Neem to Saptaparana, anything. Kromihar Chikitsa internally, Kromikuthar, Aragvat, Vidam, any formulations or AK pills, it is available in the market. Even Manibhadra Yoga is also can be given in the Kromihar. Then in the Pachak Yoga, we have a lot of medications, formulations from Rasa Pachak to Asthi Macha Pachak. Then Aragya Vardhini, Khadira, Stuck, and so many formulations. Vishar Chikitsa is most important. I want to share uh, 3 cases. You have seen the first slide, right? That is a scarring alopecia, and that patient, I tried so 6 to 7 months because I told earlier that it is the scarring alopecia. The result is not good, but though patient wanted to try, so we tried a lot. Only little the frontal hair came. Otherwise, the backside and occipital area, all the hair follicles were not there. It didn't come. So it is typically after coloring or the renovation at home that patient suddenly second or third day she faced sudden hair loss, and within 1 week total hair, the alopecia total is she is converted into alopecia total, that is a total scalp hair went out. And after that, after 3 to 4 months, all over body, all the hairs universalis. It is called in alopecia universalis. So all the body hairs came out. So here, what I feel it is some external thing is not to trigger the internal issue. So here we can use Bilwadi Agat externally, Dushivishari Agat, or Bruhadnandi Sadi Kada, or any apart from that you can use Suvana Bhasma. But I suggest or I urge everyone that use trichoscope so you can see the hair follicles are there, then we can tell them that result will be there 6 months or 1 year. But if the hair follicles are not there, how much we will try, it not comes out. Though I will ask Gala sir, please suggest on that for the scarring alopecia what we can do. Some Google we can use. Nasya oil, it is given in the classical text, but I'm using this one. Sunthi, Guru, these all are practical Nasya oil. Classical, so many oils are given, but I'm not using that. Some leaf are there, which is useful in the alopecia. Some Rasayan Yoga are there. I'm making three different formulations like Keshavati K means for the cough dominant, Keshavati P, Keshavati V, V for Vat. So this Keshavati, Vat, Pit and cough can be given in any of the Keshvika related with particular dosh. And one is Keshavati, which is a common Rasayan in which Kesha drugs are there, plus uh, the drugs related with Manohar Srotas are there. Example is Shankhapushpi, Brahmi, Jatamansi are also there in the Keshavati, because once the patient started any type of hair disorder or the shredding disorder, they have mentally they are very disturbed because of the external appearance. So here we have to add some of the Manohar Srotas related medicines to calm their mind apart from the Nasir. So here this will also work in Amal ke Nasir Rasayan for the Punarbhav Chikitsa. Some of the yogasan we can suggest like Sarvangasan, Surya Namaskar, or any of the yoga asan where the head in the lower position, low side, bending position, we can suggest any of the asana. Thank you, everyone. I will conclude my today's webinar discussion here. So anyone can ask questions, and I urge Gala sir to please give us guidance on the scarring alopecia. I am not getting much result there.
Thanks a lot. Thank you so much, Dr. Shital, for this insightful and enriching presentation. Your expertise and knowledge have helped us with a deeper understanding on the alopecia subject today, and it can be very helpful to all the doctors present here. So before we conclude, I would like to open the floor for any questions. Please feel free to raise your hand or type your question in the chat box, and Dr. Sheetal will address them. The Q&A shall be hosted and managed by Dr. Snehal Makwana.
Yes, thank you, Anand. Am I audible?
Yes.
Yes, Dr. Snehal.
Yes, excellent session, Dr. Sheetal ma'am. You have actually covered whole the body, not just the hair. And the way Dr. Gala has taught us about Shodhan, Shaman, and Bruhan, you have covered everything well. There are few questions in the chat box. Everybody feel free to raise your hands and ask your questions. Before that, I'll cover up the questions from the chat box. First question is from Dr. Raman. Lap has to be used after how many days? After how many days of what, I'm not sure, but the question is lap has to be used after how many days?
Okay. So I will not suggest it is a leaf. I will tell it is a prachan. So what I am doing is I don't know about the different leaves, but Sanjeevani Vati or Icha Bhevi Ras you can use dilute in the water and do our gharshan. We have to irritate the skin first, and keep the rest lip or the rest drugs there for even overnight. So it will be okay to be there overnight. It will give a little irritation first, and sometimes if the blood is oozing from the erosions, it will be good enough, because we have to ultimate do the irritation in the greasy skin. So that type, if the lip is if you can call it as lip, then it is better. But otherwise, I will tell it is avgharshan. You have to avgharshan. You have to rub it on the scalp, not lip, doing lip only. So
Okay.
this is the first. This is the first thing, avgharshan. When the hair follicles coming out, then after you can use Hastidan Masi or any type of Meshashrung Basma to regrowth the hair follicles properly. Okay. Am I clear?
Yes, Dr. Sheetal, we did hear you.
So
Dr. Snail?
is
Yeah.
that the question or that is a different one? So you can use avagharshan with the parijat also, but parijat is not easily available at any time in the clinic. That's why I'm using first is avagharshan with the sanjeevani or ichabedi, or even gunjakalp. You can use. Best one is dharma pen, because it is properly we are giving erosions with the medically. It is not anyhow we are giving abrasions to the scalp. So it is very well mannered abrasions, or you can say the erosions in the scalp. So Dharma pen will be better.
Okay. And next question is what medicines to be applied along with derma pen or derma roller?
Uh, no medicine should apply. Now, first understand that derma roller and what derma pen are doing. First, if any part in our body, when we get any erosions or any cut, so body is generating growth factor. So in the plasma, growth factors are there. So they come up to heal the scalp. So that growth factor triggers the hair follicles to come out. That's why we should not actually use any serum or anything on the derma roller or derma pen. Now, right now, there is another practice. What the doctors are doing, like psychologists, they are using your PRP. So PRP, they are using plasma-rich, platelet-rich plasma, and they are using that plasma after derma roller. So you can do it also because it is generated from your blood. So you can use it if the centrifugal machine are available at your clinic. Then you should use only that PRP, not any other outside any other serum.
Okay. Ma'am, I request you can stop your screen sharing now.
Okay.
Next question is two doctors have asked similar question. One is case of irritation with Jaipal, what to use, and this with that same another doctor has asked a lot of doctor use bhallatak for causing irritation on the alopecia patch, which then result in the formation of blister. After the blister bursts, there is a regrowth of hair in the patch of alopecia. The both would like to know your thoughts about this.
Yes, there are both the plants are used for that, Bhallathak and Jaipal, and both have the similar the outcome is blister formation, sometimes fascicular formations. So only thing is, I am practicing in Mumbai, so there is some issues with the external appearance or sometimes with blister formations, and patients are not pravarsatva. So for the safer practice, we can use this derma roller or derma pen instead of that Bhallatak and Jaipal. So even Jaipal oil is also better to give the counter irritation. But I suggest to start with leech first. So it will also give the more and more blood circulation and open up the hair follicles. Either you can use derma pen or derma roller. So it will properly in a city like Mumbai, it is better compared to the Bhallatak. But yes, if you have hand on Bhallatak and Jaipal, you can use it. So after that, they have blister formation. Then once the blister is proper, there is lot of burning sensations are there. So at that time, one can use Shatadhot grit. Even Dhanya Ras is also working for that.
Okay. Uh, Dhwani Raval asks that can Kshar be used for Prachan Karma?
Yes, char can be used for the prachan karma. It is also giving irritations. So I have used Ark Lavan and 1 minute. And another one is Apamakshar. But I didn't get the fast result. Like within 1 week, at least the irritation should be there. After 20 days or 25 days or at least 1 month, the new hair follicles should be there, or some hairs coming out from the hair follicles. That is the treatment protocol. So if it is not coming within 20 to 25 days, then you should shift to the another thing. So I use all this, but I didn't get much result compared to this.
Okay. Dr. Shivam is asking, can we use Parijat leaves for the Avagharshan?
Yes, yes, you can use it.
Okay. Another question is, which oil should be used along with Dermapen, which you have already answered. Uh, I heard about GFC therapy, growth factor therapy. Is it good or beneficial?
Yes, it is there, but ultimately, first we have to do our Sam Niram treatment. If the patient is in Niram condition, then only this all the treatments will work. Otherwise, so many patients came in the clinic after doing PRP even. The PRP failed. It is not because the PRP treatment is not good, but patient is typically Clayjanya, and if we are giving PRP, it is not used. So after doing Niram condition, PRP or dermal will work. Otherwise, it is not working much in each and every one, and we are not getting actually result in every patient with the PRP or growth factor therapy.
Okay. Mm, how to make Jaipal oil?
Same like gunja oil, same method. Kalk, making kalk and quathan, same method. So the ratio will also be same like gunja tel, but it is not in the market. I searched so many companies and all. I asked so many, but no one is making. So at the our college, science college, I asked to one of our Rasastra student. He made for me. So it is good in working. Even it is good in dandruff also, in hair fall plus dandruff, or in any of the clade janya condition, or even in lice also. So we have to dilute with other oil which is suitable for the disease like dhatur patradi plus jaipal, like that.
Okay. I will extend the question, ma'am. Can you give the reference of Gunja oil?
Shalanta Sanhita.
Okay. And the next question is alopecia caused due to prolonged use of dyes on the hair?
Yes, but that will be the different alopecia. So, yeah, but I don't think so. Not alopecia areata, but different alopecia, it can happen. Yes.
The last question is from Dhwani. Vellus hairs are pathological or the positive result of the treatment?
Both. You can see both two type of hairs, like terminal hair, that is full mature proper hair, every characteristic of hair. The another one is small hair, that is vellus hair. So it is in it is normally it is there in the scalp or in the body, and apart from there, this vellus hair, which is non-pigmented, that is a treatment result. That is a positive result. So initially it is vellus hair. After 4 to 5 months, it is mature terminal hair. It converted into the terminal hair. So for this treatment, vellus hair is a positive sign, but it is before our treatment, vellus hair we can see like black color. Then it is the vikruti.
Okay. Next question is from Dr. Yash Thakur. Patient has hair thinning issue, but no bald patches. What Chikitsa Sutra should be used?
So first of all, you have to evaluate by thinning. So if male patient or female, can you turn on your mic?
Yes, Dr. Yash, please, you can unmute yourself and you can discuss the case. That is fine. Female patient, ma'am.
Female patient. So thinning after so many things, like female has postpartum thinning is there. Then female androgenic alopecia is there. There is a thinning all over the scalp. So we have to evaluate first thing why the thinning is there in the thyroid also the thinning of the, so any hormonal disturbance in the body or not. First you have to evaluate that. Associate any disease, thyroid diabetes, anything is there, some psychological issues there. So first you have to evaluate the thing and then you have to do the treatment part. It comes under alopecia, definitely, but it is a different alopecia. So you have to treat accordingly.
Okay, doctor has added a detail that the patient is female, 21-year-old, thinning from since 1 month.
How she told that thinning is from 1 month only, because we
Dr.
cannot.
Snehal, yeah, Dr.
Yes,
Shital, I've enabled the mic for Dr. Yash.
yes, yes, Dr. Yash Thakur, you can unmute yourself and you can give more detail to doctor so she can guide you better.
Hello, ma'am. Can you hear me?
Yes, yes, yes. Okay.
The patient is actually, ma'am, 21 years old.
Okay.
She reported hair thinning for about like 1 month. She is feeling like that. Whenever she uses hair conditioner or anything, her hair falls too much.
Right.
And she feels like her hair is getting thin, like that.
Okay. Okay. In hair follicle, hair falls are profuse. So you
Yes,
first
yes,
you
yes, ma'am.
first ask about the menses history. The second ask about the previous any illness in a last few months. The third one
Ma'am,
is any kind of junk food she is eating from outside.
yes, she is eating junk food like once in a week, twice a week, and she also skipped menses for 1 month.
Yes, so there is artho dushti is there right now. So rasa pradoshas chikitsa you can give, and after you see the niram condition, you can start bruhan
Yes.
chikitsa.
Okay, ma'am. Thank you, ma'am.
Because it is very short span, na? It is only 1 month,
Yeah,
so
yeah,
it
yeah.
can be any triggering factor. Sometimes no, in the exam time also the students are facing same type of issue.
Okay, ma'am. Thank you.
And the last question is from Dr. Shivam again. He wants to know your view about hair transplant.
Hmm. Yeah, difficult question. So okay, so there is my point is clear. If the person is not married and they are willing to marry, or they are searching for the bride or groom, and after doing all the other matlab, every pathies and using every treatments, they should do hair transplant. If they are not getting result with any of the pathies, then only. If the patient is married, then they should not do hair transplant. And otherwise it's their personal choice. Otherwise their personal choice. After marriage also they want to no, they want more and more confidence or external appearance. They are more concerned, then they can do hair transplant. But after doing every patches or at least trying everything, then after, not initial stage. I have seen a lot of patients before married, because they have very low confidence. They have rejected by the opposite gender. So I suggest them, don't do anything. Go with the hair transplant. At least you will get your choice in for the the life partner, and then let us see. Parallelly, you can do with the treatment internally.
Yes.
It's very difficult. It is really very difficult. We are confused to give answer every time, because it is not suggested to do hair transplant basically, as per our point of view. But if after doing so many things, when patient is not getting result, you don't have any choice to give them confidence. Then you have to suggest anyhow to do hair transplant, or they have only 3 months, they have marriage. So what you will give 3 months? How can you give the more and more hair on the scalp? So you have to tell that do hair transplant instead of that, or they have only 6 months. So it's depend upon the situation.
Yes, I used to go to Dr. Dilip Thakkar, the famous dermatologist in Mumbai. He used to give same advice. If you are married, go for hair treatment. If you are not married, go for hair treatment. Married, छोड़ दो, partner मिल
छोड़ दो.
गए.
Yes, same.
Dr. Praveen Tuppad has raised his hand. Please, Anand, if you can unmute him and he can ask his question. Praveen, you can unmute
Yeah, Dr.
yourself.
Praveen.
हेलो आवाज आ रही है
Yes.
Yes, Praveen.
हाँ जस्ट वांटेड टू आस्क जी कि व्हाट इज द टाइम ऑफ फॉलो अप एंड if person is losing much more hair, how you convince about the stress part?
You have to
Because
show
bal
yes, you have to show your confidence to them. When you are confident about the sequence of the result, then the patient will be convinced. Because I showed the patient the first visit, the hair, how much hair fall was there. After second visit, in the 1 month, the hair fall was double amount. And the patient, every day patient was telling me that today the hair fall is double than the previous one, the treatment is working or it is a reversing treatment. So the thing I told, that 1 month the hair shade will be there, you cannot ask me every day, it will be there, you will be more and more sparse hair, you will be more and more, your patches will be seen visibly. Don't worry, after 2 months you will tell me the result is good. So you have to generate the confidence after seeing a lot of patients. Otherwise, really, that is very difficult in my initial practice. I am also getting confused, like how I will react the patients, like why the hair falls are more than the previous treatment. So that is the thing. Hair falls will be there, and that's why trichoscope will help to diagnosis. It is in emergent phase, not emergent phase में patient होते ही नहीं है. That's why वो अपने पास आते हैं. So it is catagen or telogen phase. If it is in telogen phase, tell them कि 1.5 महीना लगना ही है, आपको 1.5 महीने तक मुझे नहीं बोलना है. And then after, the medicines will work on the body and then scalp.
and what are the time of follow ups? मतलब आपका जो एक्सपीरियंस है
Follow up means follow up of the
मतलब
patient.
whenever you start to take a patient ना
हाँ.
तो you try to be in follow up ना मतलब हेयर फॉल वाले
Okay,
के लिए कि
yes,
हम लोग 5 7 दिन में नहीं बुलाते हैं.
No, yes. So
Yes.
initially, if you directly want to go with the Jaloka, then every week you have to call the patient if it is not there. So आप 15 दिन में बुला सकते हो, तो at least क्या होगा, that the patient is also in calm mind. Okay, 15 दिन के बाद जाना है, and then every 15 days you can take follow. Because इसमें minimum 21 days एक हेयर साइकिल जो है पूरा होने में जाता है वैसे भी. तो वैसे भी रिजल्ट आपको 20 to 30 डेज तक नहीं आएगा. इवन हेयर फॉल स्टॉप होते भी नहीं है काफी बार. सो इट इज ओके एंड स्टार्ट विद द नस्य. सो इट विल give all the calmness and clear the path.
Okay.
What I feel is main is the hair regime and food regime. वो उनका अगर ठीक से हुआ ना, तो they will give the faster relief result than our
Okay.
thinking process. Yes.
चलेगा. Thanks.
Okay,
Right
we are
now,
on.
right now we all know that is Lavan and Shar. It is given in the text, but right now in our food we are using Lavan and Shar more than the previous time, like our ancestral time. So this is very basic things. Katu, Amla, Lavan. Food we are using much. And उसमें हमने बेकरी प्रोडक्ट्स वो सब ऐड कर दिया है, जिस इज मधुर रसात्मक मेनली. तो हम ज्यादा से ज्यादा ऐसी चीज खा रहे हैं जो हमें हेयर फॉल करने ही वाला है. सो खाली तो इज हेयर. सो अभी हमें फूड मेन तो पूछना है और उसमें हमें चेंजेस करवाना है. इसलिए मैंने बहुत सारी स्लाइड में आपने देखा होगा हरी तक की एनामल की. So Haritaki Namalki is the main treatment. If the patient is cough and Vata dominant, Haritaki you can select. If it is Pitta dominant, then Amalki you can select from the first day even. क्योंकि वो दोनों मेडिसिन के लिए आपको दीपन पाचन जरूरत नहीं, वो अपने आप होना शुरू हो जाता है अगर वो लो डोज में है तो भी. So you can start with that. They both are all lavana pancharasa. So we are using 4 रस in our food. और उसमें हम लवण सबसे ज्यादा यूज करते हैं डायरेक्टली इनडायरेक्टली. और वो जो है हरितकी नामल की अलवणा, तो वो कैसा है कि हमारा ओवर यूज ऑफ लवण रस उसको वो कंपनसेट करता है. दैट्स वाई वो दोनों के दोनों हर्ब्स कोई भी कंडीशन में आप यूज करो, कोई भी फॉर्मुलेशन में.
जस्ट ऐड करना था, मतलब मैंने एक्सपीरियंस किया है कि सिर्फ हरितकी से अच्छा ये अच्छा पड़ता है, घी और सुरवारी हरड़ा.
Okay.
It's definitely psoriasis patient or anyway, any skin,
Yes, yes.
epidermal
So
part जो
that
भी है.
is, yeah, that is Erendbrust and Grutbrust Haritaki, both are there. I have mentioned in Anuloman drug list. So if the Prakriti is with dominant, then Grutbrust Haritaki is better than Erendbrust Haritaki.
We are already past
Thank you.
10:35. There was one raised hand from Dr. Darshana. Ma'am, if you have question, we can take last one. Otherwise, we can wind up.
Dr. Snail, I've allowed her to unmute herself.
Yes, ma'am. Darshana, ma'am, you can unmute yourself and you can ask your question. That will be the last question from the day. She is not in the meeting.
Yes.
We can conclude, Anand. I guess all the question answers are.
Neil, Gala sir is there.
Yes, sir. If you can unmute and
Sir,
can give comments.
Sir, please sir, give light on the scarring alopecia. How to give result, or what should be the thought process?
I don't see him in the attendee list right now. It looks like he dropped off.
Okay.
So I think we can. So anyways, I think we'll have to conclude here. Thanks everyone for your active participation and engaging questions. We hope you found this session very valuable and informative. Once again, a big thanks to Dr. Shital Trivedi for sharing her expertise with us today, and thanks to all the participants for joining us. We look forward to seeing you in our next Gyaan Vardhini session, which is scheduled on 27th of November to be conducted by Dr. Chinmay Fondekar. The topic is Rasa Aushadhi prescriptions in common GI diseases. Please also join our spam-free Gyaan Vardhini WhatsApp community group to get regular updates on our upcoming webinars. The link for the same is given in the chat of this webinar. You can also check out our earlier conducted series of webinars on our YouTube channel, and the channel link is also copied in the chat of this webinar. This webinar's recording shall be updated on our YouTube channel within the next 1 to 2 days. Wish you all have a wonderful evening. Thanks a lot. We are closing this webinar now. Thanks again. Good night.
Good night, everybody.